Now, very commonly, this metoclopramide drug is used. It is very famously available with injection Reglan. It's very commonly used drug. Now, we must know that this is a prokinetic drug because it increases the motility and it basically relaxes the pyloric end and the first part of the duodenum, and basically it increases the intestinal peristalsis, and it promotes the emptying of stomach. So it, in short, it acts in the central, it acts in the brain, it crosses the blood-brain barrier, and it promotes the gastrointestinal tract transit time. So it speeds up gastric emptying. This is the main reason why this metoclopramide is used, and it does it by enhancing the coordinative propulsive motility, which is an excellent property of this drug. So in short, it increases the gastric peristalsis. So food is moved faster from the stomach to the duodenum and to the lower portion. It does it by relaxing the pylorus and first part of the duodenum. It also increases the lower esophageal sphincter tone. This is how it is also beneficial for GERD. So it prevents the gastroesophageal reflux disease, and this property is also used whenever the patient has to be taken for general anesthesia in an emergency case, so as to improve or increase the tone of the lower esophagus sphincter and to prevent the aspiration pneumonia. So it increases the intestinal peristalsis, but it has no action on colon motility. So it doesn't affect the colon motility. It basically acts on this chemotractor zone. Hence, it can cause the extrapyramidal symptoms or the abnormal movements. And it also acts by blocking dopamine 2, that is D2 blockage. It also shows 5-HT4 agonism. We'll be coming to that very soon. As this 5-HT4 agonism is there, it will increase or enhance the acetylcholine release from the meningic motor neurons. This is how it increases the gastric emptying. This is how it increases the duodenal emptying also, and it promotes gastric emptying to the small intestine. And it also does 5-HT3, that is serotonin antagonism, and at high dosage it blocks the 5-HT3 also. So it acts at both 5-HT4 as well as 5-HT3, and it causes both anti-emetic effect also, and it also acts by increasing the meningic motor neurons, and it causes gastric emptying and duodenal emptying to promote the nausea effect, to improve the vomiting effect, and to prevent aspiration, to prevent gastroesophageal reflux disease as well. When given orally, the onset of action, it takes around half an hour. When given intramuscularly, the action occurs within 10 minutes, and when given IV, the effect comes within 2 minutes, and the usually action lasts for around 4 to 6 hours. So very commonly injection Reglan is given around 6 to 8 hourly, very commonly. The side effects of this drug is sedation, dizziness. Patient may sometimes have loose stools. Patients may have dystonia because this drug act in the center. It has central acting property, whereas domperidone lacks this property. That is the reason why the extrapyramidal symptoms are not seen with domperidone. And the galactorrhea and gynecomastia is very common because it blocks the dopaminal uh, actions, D2 action. Usually 10 milligram is the dose which is given orally or IM or IV, and it is usually given 8 hourly. Perinom is one of the most famous brand, and Reglan is also a very famous brand. So for vomiting, because it increases the gastric emptying, automatically it will reduce the food burden or liquid burden which is present in the stomach, and it will reduce the vomiting. And also it has central effect acting on chemotractor zone. That is how it reduces vomiting. So it is one of the very commonly used drug to prevent nausea, vomiting, especially in post-operative cases, especially for drug-induced cases, because this has activity at chemoreceptor zone in the brain. Radiations, uh, radiation-induced or chemotherapy-induced nausea, vomiting also is very well treated by this metoclopramide because it has 5-HT3 antagonism as well. Uh, that is the reason in anti-cancer patients, those patients who are taking anti-cancer drugs, these patients can be given up to 1 to 2 milligrams per kilogram IV if it is needed. So it can be up to 70, 80 or 90 milligram per day as well. But the chances of then extrapyramidal symptoms may increase. Very commonly, to promote the antiemetic effect, nausea reducing effect, it can be given with promethazine, diphenhydramine because they have anticholinergic properties, or it can be also combined with diazepam and lorazepam to reduce the dystonia. So if we want to reduce the chances of dystonia, extrapyramidal symptom, and if we want to have good antiemetic property, this metoclopramide can be given with these two drugs because they have anticholinergic property, or we can give with diazepam or lorazepam. The dexamethasone very commonly augments the efficacy of metoclopramide, so it can be used maybe in a single or two dosage, like dexamethasone 4 milligram, 2 milligram can be given with metoclopramide to augment the effect of nausea, vomiting reducing property. So this was all about metoclopramide. Thank you.